medical director, I was supposed to take care of the clinical trials and all the regulatory documentation and things like that. And that was the time that the pharmaceutical industry took Dr. Benson to court. The pharmaceutical industry as a group accused Dr. Benson because of the Generics Act. Okay? And so the good thing there is that my company, the Bristol Myers, at that time, newly minted as a merged company, decided not to be part of it. And I told them, why would we be part of it? Eventually, how can you not appreciate the generics when all it says is that people should actually be informed of the drugs that they're taking? I could not understand it. But if you review the past, one of the top cardiologists in the country actually declared that how dare you tell the doctors what to prescribe. We have spent our years and experience learning how to prescribe medicines, and how dare you tell us what? And if we don't want to use this brand and we want to use this brand, that is our prerogative because the doctors know best. I could easily have taken that position as well, except that my previous association with Dr. Benson has already molded me in a way that I was able to see both sides. No? And so eventually, they lost, of course. And my boss, he was an Italian-American, was so happy because he also thought that that was how it should be. And so they liked me so much, but I said that after 10 years, I was going to go back to full practice. I never left my practice. I was starting my practice. But they said that, no, maybe, Eugene, maybe you have a marketing flair. Maybe you should take up, consider being promoted to marketing. And that's why I was very weak. I was seduced by the pharmaceutical industry because being marketing director now was going to have higher perks, definitely bigger salary, When I realized maybe, for the past couple of years, I have actually been participating in the strategic planning of the company, that maybe I should give it a try. So from medical director, where I was so convinced of the researchers of the company and that they are in fact well-deserved, I was so convinced of the value of the medicine, which was the first ACE inhibitor in the company that has actually revolutionized the practice of cardiology, that, this drug that I was giving to my patients was the best drug. It was indeed the best drug. However, when I was marketing director, I was exposed now to the business side. And when I was exposed to the business side, I had to learn profit and loss. I had to take a look at the balance sheet. And when I saw that this great drug was actually very profitable, and I was now prescribing this drug to my patients who cannot really afford the kind of price that we have actually dictated on Capoten. It's okay, wala na yung Bristol Myers Squibb, nagsara na. I felt there was conflict. I really had conflict. No? And so, after 2 years, I said it was time to go for me. But it was during this time that I have my epiphany. Because it was during this time that, from the business end, I was looking at the practice of medicine from the other side. And I was seeing behaviors of my colleagues that were not elegant at all. And I was seeing things, the kind of reasoning that was actually distasteful. Okay? The doctors that I used to hold up, in a high esteem were, after all, not as noble as I thought they were. And that's about the time that I also watched the movie. Patch Adams. That's about the time, the Patch Adams. And the movie was funny. And the movie actually just kind of made me realize that there was so much about medicine that was in me that I was not able to really just, dot the T's and dot the I's and cross the T's. No? It was something that I easily identified with. So during the last time that I was marketing director, we were required to do to have our annual checkup. And this is how it's all started. I decided that instead of having my executive checkup in Medical City, where everyone knew me, I would have it in another medical center, supposedly at that time the best medical center in the country. And I told my secretary that I should not be, when you make all this, I was not a doctor, I was just a pharmaceutical executive. And I psyched myself. I said I was going to drive myself there, and I was not going to be arrogant or expecting special service because I was a doctor. I was just going to be there, and I was going to take down notes, and I was not going to actually show any resistance. So when I got there, I went straight to the admitting. And in the admitting section, it was kind of 7 o'clock, 8 o'clock in the evening. They were talking among themselves, the people. They were not even looking at me. And they just said, you fill this up. And then they continued talking. So you see that the service was terrible. And I just said I was going to be humble. Okay? And then you just wait, sir, because you will be brought up to to your room. And when I was brought up to the room by a wheelchair, nobody was talking to me. The guy who put me pushing the wheelchair was actually trying to get it done, get it over with. And then, tapos na. No? So I was there in my room, and I said, well, this is supposed to be the best medical center. The room was not so good. The nurse went in and just gave me a checklist. The checklist of the diseases that you have, things like that. So it was a checklist. Nobody talked to me. And I said, wow, nobody was talking to me. And then there was you're supposed to just read that the first thing in the morning, somebody will come in for your enema, and then you will have the scope, you will have the blood test, and so on and so forth. So there I was, and I was not being talked to, and nobody was explaining. At about 4 o'clock in the morning, there was a knock, and there was this nice guy. Okay, Doktor, magandang umaga po. Na po tayo, maglilinis na tayo, labatiba. Okay? And he was talking. Sabi ko, finally, may nagsasalita, may nagkukwento sa akin. Kailang problema, the longer the labatiba, the topic was getting more, the talk was more exciting. Sabi ko, tama na muna tayo magkwentuhan. Tapusin natin ang labatiba. What traumatized me was that I was brought down to the scope room, proctosigmoidoscopy. And so I went in, and there was this, supposed to be the doctor. And it turned out that Dr. Benson knew this doctor very well. No? I didn't know him at all. And he didn't even bother to talk to me. And so I was just led to the table, cold, and I was positioned like a superstar with your pakita sa puwet, no? With the light, right? So you can feel that you are really just a piece of meat, no? And then without any sound, suddenly there was something cold and slippery. And then it went into my hole, and then it was over. But this time I felt that I was really violated because he was not talking to me. So right after that, they wiped me clean. I approached him. And I said, Doctor, did you see anything wrong? And he just looked at me. No. He said, no. So I was really, literally, just an asshole to him. I really said I was just an asshole to this guy. Asshole. And so that was gone. Then I was so embarrassed because the next one would be the barium enema. So naka-robe na, no? You go to the X-ray room, barium enema, and the guy just hollers, your last name, calls you when you're next. And then suddenly there was a call, Dr. Ramos, Dr. Ramos. And here was this lady who used to be my patient.